Frequency Podcast Network. Stories that matter, podcasts that resonate.
A growing crisis. Those are the words used to describe the state of Ontario's jails. From overcrowding to unlawful treatment of inmates, which in some cases were so unacceptable that sentences were either reduced or charges, even murder charges, were stayed to make up for the way people were treated. And not to mention the growing inmate population of those who are simply just awaiting trial, who are technically innocent under Canadian law, but are still behind bars because where else is the criminal justice system going to put them? Provincial Ombudsman Paul Dubé released his annual report last month, raising alarm bells for what goes on in some of the most secretive institutions in Ontario.
While much of our work addresses concerns around service delivery, many of the issues that we encounter go far beyond mere inefficiencies. They raise profound questions about fundamental human rights. Nowhere is this more evident than in Ontario's correctional system, which is frankly in a growing state of crisis.
I'm Maria Kestane, and today on The Big Story, I'm talking to Jessica Evans, assistant professor at Toronto Metropolitan University's criminology department, to break down the findings of this year's report and to help us understand what exactly is going on in Ontario's jails. Thank you so much for talking with me today, Jessica.
Oh, so happy to be here. Thanks for having me.
So right off the bat, Ombudsman Dubé starts off this year's report essentially digging into the way jails are being run in the province, highlighting its many issues that, if it weren't for the report, Ontarians or Canadians, for that matter, wouldn't even know that it was happening. So let's dive right into it. One of the first things he mentions, and probably one of the most dangerous, is the physical state of the facilities, which he says are overcrowded, some of them operating at over 150% of their intended capacity, which in some cases could look like 3 people in a 2-person room. What do you make of the overcrowding issue? Is this something new that we're seeing?
So no, it's not something that's entirely new, but it is something that's kind of endemic to the system. And this is true kind of across Canada in the provincial systems. Maybe just for your listeners who don't have a background in this stuff, we have two levels of corrections in Canada. We have federal and provincial levels of corrections. In the federal system, you see people that are serving 2 years or more. In the provincial system, you see people that are serving short sentences under 2 years, and this is kind of the vast majority of people that are incarcerated provincially, you have people that are awaiting trial. So in 2023, in the province of Ontario, for example, 82% of the provincial prison population were people that were awaiting trial. They were on what's referred to as remand. So these are legally innocent persons. And that figure is approximately the same in any province. We have figures varying from 60 to 80% of the provincial prison population being people that are legally innocent, being held on remand. And so this issue isn't new because the kind of excessive use of pretrial detention has been something that has been creeping up over the last, 10 to 20 years. But certainly it is at kind of a crisis point right now. So overcrowding is something that's not new, but it's certainly something that has been gaining more attention in recent years.
Right. Yeah. You touched on the fact that a lot of these people that are being held in these jails are literally awaiting trial. So again, as you said, they are technically innocent. We're going to touch on that later. I think, a lot of people would argue that, 3 people in a 2-person cell really isn't much of a inconvenience, considering these people are in jail and it's they're not on vacation. Is the issue of overcrowding one about inmate convenience, or is it about safety, really? What are people not understanding about that?
Yeah, absolutely. So there are significant safety issues here at play. Certainly, if we're thinking about the overcrowding, we also need to think about the poor ventilation in these spaces. We need to think about the cleanliness and hygiene. And for example, during COVID-19, the transmission of communicable disease is obviously going to be much more significant when you have people in these cramped and close proximities. And so we saw a significant period of provincial decarceration during COVID, largely owing to the overcrowding situation, right? The overcrowding posed a significant threat to not only the people that were incarcerated, but also to the people that were working in those spaces. And when people that are incarcerated, find themselves ill, This is not only something that's going to affect the imprisoned people or even the people working in those spaces, because these are people that are coming back into our communities. The vast majority of these people are not going to be serving life sentences. And so when they come back into our communities, they're often coming back into our community with protracted healthcare issues. And this leads to one, potentially the spread of communicable disease in community. It leads to excessive use of emergency departments because people aren't connecting to family doctors or they don't have family physicians. It's looking like longer wait times for people that are visiting emergency departments and so on and so forth. And so the issue is not an issue of convenience. It is an issue of safety. And it's an issue of safety that doesn't only impact prisoners, but it is going to impact us in the community as well. Because once again, people that are incarcerated are not incarcerated indefinitely. They're coming back into our communities. And so the challenge to the overcrowding issue is also a challenge to us to ask us, when people come back, do we want them coming back better than when they went in or worse? And certainly if the goal of our criminal legal system is reform and rehabilitation, then the answer should be that we want them coming back better.
One of the things that we talked about before we, began this interview was the fact that one of your areas of research was about the medical space in Ontario jails and the state of healthcare in Ontario jails. Can you speak a little bit about that kind of fact? What kind of rights do inmates have in terms of healthcare? What are we seeing in Ontario's jails in terms of access to medicine, access to healthcare, or access to even culturally appropriate healthcare? Because I know a lot of Indigenous populations are serving time in Ontario's jails. What does that kind of look like right now?
Yeah, this is a great question and one that I could gab on for hours. So I think the first thing to understand is that when you are incarcerated provincially, you remain covered under OHIP, so you do not lose your right to healthcare. Now, when you're incarcerated federally, that is a different story. You lose your coverage under the Canada Health Act, and that coverage is then taken up by Correctional Services Canada. However, despite retaining your OHIP coverage when you are provincially incarcerated in Ontario, your healthcare is not being provided by the Ministry of Public Health. It is being provided to you by the Ministry of the Solicitor General. So people that are incarcerated are receiving healthcare through a different healthcare system than people in the general public receive their healthcare. And this creates a lot of issues in terms of continuity of care. So, for example, if you are on the outside and you have a diagnosis, and then you get arrested and you get put in a provincial detention center. If you don't have your prescription or your diagnosis on you, you have to wait to be evaluated by a doctor that is provided to you by the detention center. And oftentimes you will get different diagnoses. So people have interruptions in their medication regimes. Sometimes they wait months to get access to medications and so on and so forth. Similarly, when you are incarcerated and you're receiving treatment for any range of healthcare conditions, when you leave the institution and come back into community, once again, those files do not transfer over. So you have to start over again once you're in community. I did research around the experiences of prisoners during COVID-19. And one of the ways that this manifested was that people that were released during COVID-19 could not get their vaccination records confirmed when they were released into the community. And so they did not have access to shelters, to libraries, to any range of systems that are necessary for people that are reintegrating because they could not verify their vaccination status. So there is a separate system of healthcare in place for people that are incarcerated. And this creates a lot of issues in terms of continuity of care. The second thing that I would flag is that because incarcerated people are often subjected to their cells for periods of time, when they have a healthcare request, they have to make that to a correctional officer who is the person that then determines whether or not that is a verifiable health concern and whether or not to pass that on to the medical team. And so we have a situation in which non-medical people are making medical decisions. These are people that are trained in corrections, not in medicine. And so oftentimes people's healthcare needs get dismissed. I interviewed a woman when I was doing research around COVID, and she had a preceding diagnosis of something called hyperemesis gravidarium. She was 5 months pregnant. And this is a condition in which the pregnant person is experiencing morning sickness that is beyond the kind of average form of morning sickness. And it can be to the point where they're not able to keep down any nutrition. And so they're not getting vital, nutrients, they're not getting calories, and so on and so forth. This can be very dangerous both to the pregnant person as well as to the pregnancy. This person consistently requested medical assistance and was consistently ridiculed by correctional officers. They just said, "This is morning sickness. You have to deal with it. Don't be such a wimp," and so on and so forth. And unfortunately, this person ended up losing their pregnancy as a result of that. And so we have a significant issue in place where correctional officers are making decisions about people's medical care despite not having the training to do so.
In that kind of situation, then what would you recommend as the alternative? I mean, I'm just thinking like realistically, when you have correctional officers and they're doing their job and they're monitoring cells and inmates every day, would you recommend then some medical personnel coming in once a day or a few times a week? Like, what would you think is the appropriate course of action there?
So I think one of the biggest changes that we can make, and that has been shown to kind of have positive impacts, is transitioning or transferring rather responsibility, apologies, of prisoner health care to the Ministry of Health. We've seen this happen in a few different provinces, most recently in British Columbia. And by all accounts, the outcomes are much better. Again, you're having people that are, connected to public health systems, that have connections with public health systems and resources from public health systems, able to make these decisions. You do have increased personnel. You have people with better job satisfaction. You have people whose job it is exclusively to deal with medical issues, not security concerns, making these decisions around medical health. And you also have continuity of care between when someone is inside and when someone is outside, which can address a lot of ongoing issues. And so my kind of thing that I'm kind of beating right now is that we really do need to start taking action towards transitioning the responsibility of healthcare to the Ministry of Public Health.
I want to go back to how you touched on the fact that a lot of these inmates in these correctional facilities, they are technically presumed innocent and not guilty because they're just awaiting trial. I mean, what do you even make of that? We could do a whole episode on this in and of itself, but what do you make of the fact that majority of inmates in Ontario's jails are simply just awaiting trial? They don't even know if they're guilty of the crimes they've committed.
Yeah, so this has a number of facets, and I'm probably going to forget some things, but I'll just shoot off a few off the top of my head. The first is that these are institutions that are built for people technically that are serving 2 years or less or awaiting trial, right? However, we know that with court backlogs, people are waiting more than 2 years. However, these institutions do not have the kinds of supports for people to be in there for longer than 2 years. So, for example, programming, access to therapies, access to work, and so on and so forth. Things that you might see in a federal institution are not available to people in provincial institutions. And so oftentimes that extended time that they're in these spaces is really just spent kind of sitting around. They don't have access to the kinds of programming that might be useful for people in these spaces. The second thing, though, is that, if you are detained and held on pretrial, and you are found legally innocent, for example, that does not mean that you have not been harmed by the system, because in that period of time, you've likely lost your employment, you've lost your housing, you've possibly had disruptions to your familial and your kind of broader social connections. You may have had disruptions to your healthcare treatments, and so on and so forth. And so when people are spending these extended periods of time locked up while they were presumed innocent, a finding of not guilt does not repair the harm that has occurred in this situation, right? Because once again, these people are going back into a world in which they have lost a lot of what was supporting them in the first place. So that's a significant issue as well. The fact that 82% of the population in prisons, or in provincial institutions rather, are people that are being held pre-trial, this also kind of indicates failures in the bail system, right? What is accessible bail? Do people who, are approved for bail, do they have the resources necessary to make those kinds of things? Can they find a surety, and so on and so forth? And while Premier Ford likes to go on a lot about dangerous offenders, we know from the statistics and the data that the vast majority of people that are in this situation are not violent offenders. They are people that are there for minor infractions. And so you have this kind of situation in which people are being criminalized in these ways when they may not have actually committed any kind of criminal harm or very minor forms of criminal infringements. But they're being pushed into extreme spaces of marginalization owing to the fact that they've been detained. And when they get back out, they're going to have a harder time reacclimatizing to kind of socially acceptable and legal norms.
Yeah. I mean, not to play devil's advocate here, but I think, it's interesting when people hear a crime story, especially about people who've, committed crimes when they were out on bail. The first thing people say is, they should have been locked up. And while I think dangerous people should be locked up, that's such a ethical term, or that's such a gray area. It's not as easy to change bail laws because, again, the criminal justice system, it's a federally regulated institution. It's not so much a provincially regulated situation. And I think it's some people just don't understand that delicate dance of who deserves bail, who doesn't, who should be released on bail, who doesn't, what crimes should be even allowed for bail. I think it's a relatively huge gray ethical area.
Yeah, I mean, so I come from a position of being a prison abolitionist, and what that means is that I think there are a lot of ways with which we can deal with harm in our society that doesn't require further victimizing people or creating new victims, right? Because that is what our system does. Nonetheless, I do understand that people will have concerns around people that have committed, egregious or violent offenses. I would encourage people to think about the category of dangerousness, though, and what constitutes dangerousness in our society. This is a moving target, right? Our idea of danger and a dangerous offender is something that shifts historically according to social norms, cultural norms, political currents, and so on and so forth. We need only look to the United States right now and the discourse around undocumented migrants who are being labeled dangerous, while many of them are just people that lack documentation but are actually doing the majority of the work to support the economy, right? Um, you know, for a period, people that were gay were considered dangerous, right? They were considered dangerous to youth and so on and so forth. And so I think one thing that I would ask us to do is not simply accept the label of dangerous, but actually question who it is that we're labeling dangerous and why it is that we see those people or those behaviors as dangerous. And I think if we look quite closely at that, very few people would meet criteria for what we would kind of determine as dangerous. Um, and so I understand hesitations around bail reform, but again, I think it's useful to look at the data and who is actually being detained under our current kind of a bail system. And once again, I think we see that the vast majority of people are not dangerous offenders in this space. I would also maybe just back up very quickly. And, I threw the term prison abolition out there very quickly. And I know that that's sometimes a controversial term. And so I just want to flag for your listeners that when people speak about prison abolition, they're rarely saying tear down prisons and let everyone out today. Rather, prison abolitionists view harm in our society as often stemming from unmet needs. The argument is that if we kind of focused on upstream solutions about resourcing people in meaningful ways, we would probably see a much more effective reduction in harm than imprisonment, right? If people have access to food, housing, if they have access to therapy, if they have access to healthcare, harm reduction, and so on and so forth, right? We might do a lot to mitigate the kinds of conditions that generate harm in the first place.
Right. I think you and we share that criminology background. So I completely understood where you're coming from when you said I'm a prison abolitionist. And I'm sure that raised so many alarm bells. But it's crazy what just one simple criminology course can do to someone's understanding of crime and policing and community and sociology. So I'm right there with you. It's interesting you brought up Premier Ford and his echoes to the federal government for bail reform. And he wants the three-strike rule. What I wonder is if the current provincial jail system we have now is already overcrowded, what will happen if there's a new influx of inmates? Is it easy to build more jails? What kind of cost will it have on taxpayers? Who bears that responsibility?
Great question. So currently, the Ontario government over the last 5 years has made a number of different announcements about expanding our capacity to detain people in this province. So at present, there are plans to add 1,200 quote unquote beds to corrections by the year 2027. This is coming through two separate announcements. One is called the Eastern Regional Strategy, and this is pertaining to prison construction expansion and modernization in Eastern Ontario. The other one is referred to as the Northern Modernization Strategy, and here we're looking at additions to prison infrastructure in Northern Ontario. So the provincial government is looking to add beds to corrections, and will this address overcrowding in the short term? Perhaps. But once again, the premier is looking to tighten up bail conditions, right? And so that's never going to catch up. Like these additional beds are not going to necessarily catch up to the number of people we are incarcerating. I don't think that this is a viable solution to this problem. And the question of who bears the cost of this is an interesting one. Um, there is, the provincial government is putting in some money, but most of this is going to be long-term financial commitments by the province. The way that prison infrastructure in Ontario and in most of Canada, or rather all of Canada, is done is through public-private partnerships. And so while there's this kind of fiction, I think, when we look at comparing Canadian and US incarceration, this idea that Canada doesn't have private sector interests embedded in our prison system, this is actually factually incorrect. We do not have private prisons. They remain under the control of the provincial or the federal government. However, they are often financed, built, and maintained through private actors. So, for example, this recent spate of provincial prison construction is largely occurring through public-private partnerships with Don Ellis and Bird Construction, two kind of large construction and equity kind of firms in the province. And the way that these operate is the federal government will pay a lump sum at the beginning, but then the rest of the cost of these institutions is going to be borne out through monthly installments that last for a period of 30 to 40 years. So these are new pieces of infrastructure, rather, that the provincial government will be paying for the next 30 to 40 years. And this interestingly brings us back to another issue, which is that, you asked about the conditions inside for inmates. Um, the arrangement of prison infrastructure construction is actually quite consequential for the experiences of people inside. When these agreements are entered into, oftentimes the private partner is responsible for the maintenance of the institution, which means that if there are any kind of structural issues, if things break down, and so on and so forth, they are the ones that are responsible for fixing this. However, they have so many different loopholes that they can go through to delay and defer responding to these issues. And what that means is that oftentimes prisoners bear the brunt of those issues. What that looks like can differ. But for example, Toronto South Detention Center, when that was built, the private partner built the institution with glass that could shatter on impact. That became a security issue. And until that was fixed, people were kept in lockdown, which meant that they were subjected to their cells for, anywhere between 22 to 23 hours a day in these overcrowded conditions with poor ventilation and so on and so forth, not for any internal security issue, but for a failure of the private actor to adequately construct these institutions. Poor ventilation, poor waste management, and so on and so forth. These are often going to fall on the private actor, who then has a lot of leeway to defer repairing these things, which then impacts the quality of the conditions that prisoners find themselves in.
So there's not necessarily one singular actor that we can point towards to be like, hey, this needs fixing. This as in, the overall provincial jail system. It's a interconnected web of so many different stakeholders, you're saying.
Yeah, absolutely. And again, there is a business of corrections, right? There is a profit incentive that is embedded in this for these private actors. And that impacts, right, the quality of the spaces that they find themselves in. But certainly, yeah. So to address this, there are changes that need to be made at the level of kind of provincial legislation. But certainly, part of this issue also relates to the ways in which the private sector is involved in prison construction and maintenance.
Right. One of the last things I want to touch on, Jessica, from the report is the fact that the ombudsman said that in some situations, unlawful treatment or incidents involving staff and inmates sometimes become so bad that sentences are either reduced and inmates are given early parole, or in some cases, charges are stayed, which means someone's charges essentially put on hold for a time period. What do you make of that? Like, how bad could things be that the legal proceedings are overwritten with new ones to kind of make up for it?
Yeah, absolutely. So I kind of mentioned in my previous response, the Toronto South Detention Center. That was kind of supposed to be like the kind of cornerstone of modernized prison infrastructure. It was one of the first to be built through public-private partnerships. And it has kind of since then become known notoriously as the Guantanamo of the South. And that is one of the spaces in which a lot of prison sentences were commuted because of the situations that people faced inside. Another thing that often leads to reduced sentences because of the conditions is the overuse of lockdowns or I don't know what is an appropriate use, but the excessive use of lockdowns. And so the Mandela rules or the United Nations standard minimum rules for the treatment of prisoners kind of stipulate that the confinement of a prisoner for 22 hours or more a day without meaningful human contact constitutes prolonged solitary confinement. And if this exceeds 15 consecutive days, it's considered a form of torture or cruel or humane treatment. And so what we see in Ontario prisons is because of the use of lockdown, many people are subjected to conditions which meet these criteria of torture.
We could do a whole series on solitary confinement and lockdown. There's so many things that people just don't know and don't see because, again, it's such a private part of society. But Jessica Evans, assistant professor at Toronto Metropolitan University's criminology department, thank you so much for joining me today.
Thank you so much for this talk. I really hope that people hear it because there is a lack of knowledge, I think, on exactly what happens in Ontario prisons.
That was The Big Story. You can send us feedback on this episode or any other episode by emailing us at hello@thebigstorypodcast.ca or leave a voicemail at 416-935-5935. You can find us on the Seeker app or on all your favorite podcast players. Please rate, review, follow, and share. I'm Maria Kestane. Thanks for listening.